my name's Carolyn. I'm a nurse practitioner student, and I'm here to do your health assessment today. Can I ask what brings you in today?
Yes, just my annual checkup.
Great. So I'm going to start by washing my hands, and then I'm surveying the general appearance, looking for grooming. Patient appears to be in no distress, appears to be calm at this time. So starting out, just going to assess, what is your name?
My name is Evan.
Evan Latrobe.
Tyler.
Good. And then what is where are we right now?
I'm in my home.
Good. And then what is the day of the week?
It is Sunday.
Good. Patient is ANO times 3, no dysarthria, no aphasia, clear speech. So I'm going to start my assessment from the head, looking at symmetry, looking for any lesions, edema, and throughout this assessment, I'll be looking at the skin and doing an assessment based on the A, B, C, D, E's of nevi, looking for anything severe that needs to be consulted to dermatology. So I'll start by palpating the head, just feeling for any lumps, masses, hair distribution is even at this time, and good, very symmetrical. Then I'll make my way down to the face. So facial features are symmetrical. I'll have you go ahead and raise your eyebrows, close your eyes real tight, puff your cheeks out, good, and then smile, good. Cranial nerve number 7 is intact, and then I'm just going to assess the sensation on your face. So I'll have you close your eyes and just tell me if it's dull or sharp.
Sharp. Sharp. Sharp. Dull.
Did it feel the same on both sides?
It did.
Good. Close your eyes again for me.
Dull. 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 Dull.
Good. Did it feel the same on both sides?
It did.
Great. So now I'm going to start my assessment. Looking at the skin, it's dry, it's pink, no erythema anywhere, and I am going to start my assessment of the eyes. So starting with your eyes, I'm just assessing the eyelids, the external. The eyelids seem to be without nodules, no masses, no lesions anywhere, eyelashes, even distribution, and no lice. And now I'm just going to look at your sclera. Sclera is white, no hemorrhaging. I'm going to pull down on your eyes to look at the conjunctiva. Conjunctiva, look to the side, side, up, down, is pale, pink, good. No lesions, no masses, no hemorrhages there. Good. So now I'm going to test your 6 cardinal visions. So just follow my finger with your eyes. Good. Cranial 3, 2, 3, and cranial 3, 4, and 6 are intact. Good. And with the sensation being equal on both sides, cranial nerve number 5 was also intact. Now I am going to look at your eyeballs. For the purpose of this assessment, it would normally be in a dark room, but I am going to keep the lights on for the purpose of this exam. So looking at the pupils, reactive at a 3 on the left, reactive at a 3 on the right. Now I'm going to look a little bit closer and looking for a red light reflex, and it is moving in. Look straight at the light, can see the macula, the optic disc, and that is at a 1:3 ratio. Great. All right, now I'm going to have you look straight ahead. Good. Red reflex present. Able to see the macula, optic disc. Good. Orange, yellow on both sides for the optic disc. Good. Now I'm going to move on to my assessment of your vision. Testing cranial nerve number 2. I'll have you put your palm over your right eye, and being 14 inches away, read the lowest line that you are able.
LTFPH.
go ahead and switch.
LTFPH.
Good. Vision is 20/20 on both sides. Great. So now I'm going to look at your nose. For the purpose of this exam, I will not be doing the olfactory smell test with an orange, but you would close one nostril, close your eyes, and we would make sure that you can smell an orange, but that would be olfactory cranial nerve number 1. So I'm just gonna bring this into your nostril, just a little bit of light. Should just feel like a little bit of pressure. Good. It is cherry pink, moist, little bit of drainage, turbinates able to be seen. Good. And I'm going to do the other side. Again, no obstruction on either side. Cherry pink, scant drainage, and turbinates able to be visualized. Good. Okay. Now I am going to assess the ears. So looking externally at the ear, the tragus, the pinna, both intact, no erythema, no edema, no deformities here. So I'm just going to pull slightly up and back and look inside your ear. You're just going to feel a little bit of pressure. Good. So no obstructions, gray, pearly tympanic membrane, no edema, no erythema, and the cone of light is at 5 o'clock. Good. Looking at the other side, the same. So no erythema, no edema, scant earwax drainage. Tympanic membrane is a gray, pearly color, and cone of light at 5 o'clock. Great. So now I'm going to move on to my assessment of your hearing. So we're going to do the whisper test, assessing cranial nerve number 8. And I'm going to whisper a number and just repeat the number as you hear it.
44.
Good. Cover the other ear.
44.
Good. Cranial nerve number 8 is intact. Now I'm going to do my assessment of the mouth, looking externally at the lips. No cyanosis, no lesions, no edema. Good. So I will open the mouth, and now I'm going to look at your mouth. Have you stick your tongue out, move it side to side. Good. Tongue is pink, moist, no thrush noted. Buccal mucosa is noted pink. All teeth are present. Go ahead, nice, and say ah with your tongue.
Ah.
Good. Uvula visualized. Tonsils grade 1. Very good. And again, now I'm going to test your gag reflex. Good. Stick out your tongue for me. Good. Cranial nerve number 9 and 10, both intact. Okay. So now I'm going to move on to my assessment of your neck. So just looking first, trachea is midline here. Before I palpate, I'm going to auscultate the carotid arteries, just assessing for bruise. So I'm going to have you take a deep breath in and then hold it. Good. Now moving to the other side. Keep holding. Good. No bruise noted at this time. So have you move forward in the chair just a little bit. Good. Now I'm coming to your back, assessing for the thyroid. Any tenderness as I press on the mastoid processes?
No.
No? Okay, good. So I'm going to have you dip your chin up and then slightly to the left, stabilizing with the right hand, palpating the thyroid, stabilizing with the left hand, palpating the thyroid with the right. No nodules, no goiter. Any tenderness here? Good. Now have you move back, go slightly to the right, stabilizing this time with the right, palpating with the left. Again, no nodules, no goiter, thyroid appropriate. Okay, good. Your head can come come back. Now I'm just going to assess your lymph nodes here, starting with the occipital lymph nodes. Good. The post-auricular, no tenderness at all?
No.
No swelling, no enlargement here. Pre-auricular, submandibular, submental. Good. Good. And then anterior cervical, any tenderness?
No.
Posterior cervical, any tenderness?
No.
Okay. All right, good. No tenderness at all throughout that exam. I'll have you just move back again. Great. Now I'm going to start my assessment of the anterior thorax. So starting with palpation, just feeling for evenness, symmetry in the sternum, no bumps, no masses, no lesions. Again, skin here is pink, warm to touch. All right, even distribution, any tenderness throughout. Good. Okay, so now I'm going to start with auscultation of your lungs. Okay, so I'll just have you take deep breaths in and out through your mouth. Right, breath sounds anteriorly are cleared, no adventitious breath sounds. Again, keep breathing in through your nose, out through your mouth. Good. Left lung sounds, 8 places on each quadrant, all clear, no adventitious breath sounds at all. Okay, now I'm going to auscultate your heart, starting with the diaphragm, and I'll start with the aortic valve. You could just breathe normal. Good. And with the pulmonic, I'll use the diaphragm and the bell. Good. Moving down to Erb's point with the diaphragm. Good. Moving down to the tricuspid with the diaphragm and the bell. And to the mitral valve with just the diaphragm. Good. And just palpating for the PMI here. Good. No, auscultating the PMI. No murmurs, no clicks. S1 and S2 heard in all 4 quadrants. Good. Okay, so now I'm just going to assess for any tactile firmitis. So I'm just going to place my hand, say 99.
99, 99, 99, 99, 99.
Good. No tactile firmitis palpated. Okay. So now I'm just going to have you move forward, and I'm going to assess your anterior thorax, looking at the skin. No nevi present. It is symmetrical, clear, pink, and warm to touch. So again, starting with assessing for tactile firmitis, say 99.
99, 99, 99, 99, 99, 99. 99.
Good. Very good. So symmetrical throughout. No tactile firmitis heard. And again, listening to breath sounds through both lungs in 8 different points. So just take deep breaths in and out through your nose, or in and out through your mouth. And then moving 8 points on the other side. For the purpose of timing for this exam, I will just continue with 2. Good. Lung sounds are clear. No adventitious breath sounds. Now I'm going to have you stand up before you move into the bed for the abdominal exam. Have you used the restroom?
I'm good to go.
Okay. All right, great. I'll have you take a seat on the bed and lay back on this pillow. Good. And I'll have you actually move up towards the pillow and for a 30 to 45 degree angle for this abdominal assessment. And we're going to start by assessing JVD. So I'll have you just put your head back just a little bit. Turn your chin slightly to the left. Good. Looking for the highest point of pulsation and then comparing it to the costal sternal angle. And it is less than 3 at 2 centimeters. Good. No JVD present. Now I'll have you do the same thing with the other side. Feeling for the highest pulsation. Good. And then comparing it here. Less than 3 centimeters at 2 centimeters. Good. No JVD present. All right. So now I will start with my abdominal assessment. Just starting first by visualizing the abdomen. No pulsations, no hernias, symmetrical, no contour anywhere, no lesions or nevi present. Good. So I will start first by auscultating the aorta and then moving down to the renal artery. So you can just breathe normal here. No bruise present, normal finding, and now I will auscultate all 4 quadrants of the abdomen, 2 points in each quadrant. Good. Normal active bowel sounds in all 4 quadrants. And then I'm going to start with some light palpation. Just pressing around, feeling for any masses. Good. No ascites present. No hernias or masses palpated. The edge of the liver. Pressing around. Any tenderness anywhere throughout?
No.
Soft abdomen. Good. Now I'm going to move into some deeper palpation, trying to feel for some of the organs, starting with the liver. So stabilizing with the left hand at the bottom of the rib cage and then right hand down. Feeling the liver edge 1 centimeter lower than the costo-vertebral border, and liver span seems to be 7 centimeters, which is a normal finding. Trying to palpate for the spleen now on the left upper quadrant. Normal finding, no splenomegaly present. Testing rebound tenderness on the right lower quadrant. Just let me know if this causes any pain at McBurney's point.
No.
Good. Okay. And then feeling for the kidneys, sometimes able to palpate. Take a deep breath, doing good here. Right renal kidney, not able to be palpated, and left kidney, not able to be palpated. Good. All right. Now I'm just going to percuss, so just pressing down. No tympany present. Dull over the liver. 2 points in each quadrant. No tympany present. No hyperresonant sounds. Good. All right. So I will have you come sit up now again. Very good. And I'm going to start with my musculoskeletal assessment. So in this, we'll be assessing, again, skin, lesions, edema, reflexes, capillary refill, strength, and range of motion. So, starting with your shoulders, I will have you lift up. Lift your shoulders up. Bring them out. Abduct. And then adduct in. Good. Bring them together. Bring them up overhead. Good. Bring them down. Internally rotate, squeezing towards your scapula. And bring it out, hugging yourself in. Good. Okay. And then I'm going to test your elbows. So bending towards your shoulders. Extending out. Out. In. Down. Good. Now have you hold and then turn your palms in and out. Good. Very good. Now your wrists, just assessing range of motion here. Up and then go down, out to the side. Spread your fingertips wide and then back down. Very good. Okay. All right. I'm going to test your strength now. So hold your arms out in front of you. Press up against my hands. Press down against my hands. Good. Press out against my hands and press in against my hands. Good. All right. Now just testing hand strength here. Press up. Press down. Good. Strength is a 4. Range of motion is full. Range of motion equal on both sides. Good. Now I'm going to test sensation in your upper extremities. Okay. So close your eyes for me and just let me know if it's still or sharp.
Sharp. Dull. Sharp. Sharp. Sharp.
Good. Did it feel the same on both sides?
It did.
Good. And while I'm here, I'm going to assess cranial nerve number 11. Lift your shoulders up. Very good. Put them back down. Very good. All right. And now I'm going to assess again sensation. So let me know if it's sharp or dull.
Dull. Dull. Dull. Dull.
Good. Did it feel the same on both sides?
It did.
Great. All right. So now I'm just going to assess reflexes here. So brachial reflex. Just try and relax your arm. Good. Tricep. Good. Brachioradial. Just try and relax. Good. And then again on the other side. Good. Tricep. Good. Brachioradial. Good. All right. So reflexes were a 2+, normal response. Now I'm just going to be assessing pulses here. Brachial. Down to radial. Good. +2 equal in both. Looking at the hands, capillary refill is less than 3 seconds in all 5 digits. And no clubbing present. No nevi present. Skin again is warm and intact. Pressing down on the right hand. Capillary refill is less than 3 seconds. Very good. And no clubbing is present. Okay. So moving on to lower body assessment. I'm going to start again just with strength and range of motion. So extending your left knee out, bring it back in, good, and then flexing your foot towards your face, pushing back down, good, and then extending your right knee out, bringing it back in, very good, equal and full range of motion on both sides. Okay, now I'm going to assess pulses here. So is it okay for me to feel your femoral pulse?
It is.
Present, +2, popliteal pulse, good, fibular pulse, ancotibial, and dorsopedalis, +2, all equal, and same thing on this side, femoral pulse, tibial pulse, +2, +2, dorsopedalis, +2. Good. Okay. Cap refill present and appropriate in both feet. No clubbing noted. No edema, no swelling, no erythema in any of the extremities. So now just having you close your eyes, I'm again going to assess sensation. Tell me if it's dull or sharp.
Sharp. Sharp. Sharp. Sharp.
Did it feel the same on both sides? So equal.
Mm-hmm.
Now tell me again, sharp or dull?
Dull. 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 And dull.
Good. Any numbness, tingling anywhere?
No.
No signs of peripheral neuropathy at this time. Now I'm going to assess your reflexes. So starting with the patellar reflex, go ahead and just relax your leg as much as you can. Good. 2. Good. Very good. Okay. And then just assessing the Achilles reflex. Good. Good. All right. 2+ in all lower body extremities. Great. So now I'm going to move on to your assessment of your spine. I'll have you stand up. And then again, just visualizing the spine. Looks even, looking for nevi, no nevi present. Even, symmetrical, no lumps, no masses. Good. Now I'm going to have you bend over, bending at your knees, and just assessing the spine for any curvature, asymmetry in the clavicles, the scapulas, and there seems to be none. You can come up and stand. Good. Again, clavicles symmetrical at this time. Great. I'm going to now assess your gait. So I'm going to have you walk towards me. Good. No swaying. Go ahead and walk that way again. No swaying. No balance difficulties. And no issues with the gait. Okay, now I'm going to have you turn around towards me. Good. Okay, I'm going to have you close your eyes, put your feet together, and then go ahead and close your eyes. You do this for about 10 seconds. Again, no swaying, no leaning, nice and tall. Very good. Okay, all right, you can open your eyes, and then I'm going to have you walk heel toe towards the door. Very good. And then I'll have you walk back, heel toe. Good balance and coordination. No swaying, no drifting. Appropriate for the client's age. I'll have you take a seat. And last thing I might have forgotten at the beginning of the assessment was go ahead and stick your tongue out. Say ah. Move it left, right, up and down. Good. Cranial nerve number 12 is intact. All right. And this completes my assessment. Do you have any questions or concerns for me?
No, thank you.
Okay. Thank you.